Hi people, welcome back to my YouTube channel, Her Voice and Her Strength. I just wanted to show Tokyo's red dress. Hope you guys like her outfit. Tokyo, come on, show everybody, show. So Tokyo will not be here for the rest of the video because today I'm going to share with you how the diagnosis of breast cancer came to light in my journey. So let's go through this roller coaster today. Tokyo, you need to go now. Go. So, what's my story? Let's get into it. In May 2022, I noticed that there was lumps on my left breast. They were quite painful, but also at the time as well, I must have woke up one morning and my ex-partner noticed that there were stains on my top. I was wearing a white top. So what I then did was like, I thought to myself actually, let me wear another white top to bed and wake up the next morning to see if something else happens. So I did that. I saw the next day that there was some stains on my top. So I gathered that there was discharge coming out from my left nipple. I've never experienced that before. So what I did with my fast reaction and thinking, okay, there's a problem, I decided to call my GP and I told them, look, I need you to refer me to the 2-week pathway under breast cancer. My GP said, hold up, come in, let's do our internal checkups. Fine, I went in to the GP, they did their checkups. They were like, oh, there's nothing for you to worry about. I said to my GP, no, you still need to refer me to the 2 weeks pathway for breast cancer. So I got what I want. I knew how to really drive my care anyway, because I have the experience of working at the NHS. In fact, a little bit about me, I've worked in the NHS for about 2 years. And funny enough, ironically enough, I worked in a cancer department and it was a 2-week pathway. I dealt with many different cancer specialities. In fact, when I started, I was working for a big speciality. So my GP referred me to the pathway that I requested. Then in 2 weeks, I got a call from the hospital. They booked me an appointment. I saw a consultant. He did a breast examination with a chaperone because he was a man and I'm a woman. Therefore, if you do have a male consultant, always do ask for a chaperone, but they should ask you for a chaperone anyway, as a female. Well, he tried to make conversation, am I okay, all of that stuff basically. But clearly in my head, I'm calculating. In my head, I'm thinking something is wrong. Is this breast cancer? In my head. Of course, I didn't express that to the consultant. But anyway, he said he will book me for an ultrasound scan. So all of this happened within 2 weeks. I then had an ultrasound scan and the sonographer in question didn't only scan one breast, but scanned both breasts. She noticed that there was calcification on the left breast. But then again, she said to me, there's nothing for you to worry about. You're young, you can go. In my mind, I was like, how can this woman tell me to go away? There's a problem here. However, I did not contest it. I didn't challenge it. I said, okay. And the reason that is because I was going through a tough time in the workplace I was currently in. I was only in this workplace for 2 months. However, I found myself that I had to raise a grievance, which was for the first time in my life. But the only way I was able to do this was through my union. One thing I will remember about my union lady, she was a lady, and she said to me, if you're ready to put on the boxing gloves, so am I, and we can fight this. If you're not ready, I'm not ready. And one thing I want to say is that a lot of people told me, don't fight it. My union lady and actually my best friend was like, if you're ready, we're ready. So I just want to appreciate my union lady, and I also want to appreciate my best friend. Anyway, let's pass through the work palaver. But anyway, did I win the case? Yes, I won the case. I put on them boxing gloves. Actually, in fact, before winning this case with this workplace, I remember going to bed and saying to God, get me out of here. I didn't get on my knees or do some big prayers in terms of God, I need this. I just said, God, please get me out of here. Then at midnight, I remember going on LinkedIn, which I never do anyway. I went on LinkedIn and I applied for a job. You wouldn't believe it. I got a response like the next day. Well, not the next day, a few hours within that midnight day. And, you know, things started to progress with this job. I started a new job and things were still not right with my left breast. I was still having a discharge. I was still feeling pain. And at the time as well, I decided to do research on what should happen during an ultrasound. If calcification is found, should there be a biopsy that should have been done? And technically, that sonographer should have done a biopsy, and she didn't do that. Therefore, I went back to my GP and I told my GP, look, I looked up this, a biopsy wasn't done, refer me back again to the 2 weeks pathway for breast cancer, and this time I want them to do a biopsy. You wouldn't believe it, I saw another sonographer and she was the meanest sonographer I ever experienced. She didn't even tell me, oh, this is going to be a bit painful. She didn't warn me. It just felt like she just stabbed me. And she did a biopsy. She didn't tell me how to upkeep. She didn't tell me that, you know, I shouldn't clean that area for 2 days. I can wash, but I shouldn't soak it. There wasn't a leaflet for me to how to upkeep this biopsy. As you're probably guessing and probably asking yourself what's going to happen next. Well, a week before my birthday, I got the diagnosis of breast cancer. And I was livid. I was upset, I was angry, and I was thinking to myself, if I didn't push these people or go back to these people, do this and do that, and believe that sonographer that everything is fine, I'm young, who would know how it would be today for me? I probably won't be here talking to you guys about this experience. So I just want to pause there and talk about the next steps and what happened next, but on another video. And I just want you guys to think about your experiences that you've had in hospitals or you've had in other places that it's been negligent. What do you do when things like that happen? Do you push, do you fight, or do you just leave it and just think, oh yeah, that's okay? If you do that, that's not right, especially when it's your body. You need to make sure you make it your duty of care to check your body. I also want to add that you can't leave your body, your health in the doctor's hands. You've got to do it. You need to check that everything is going well and going as normal, basically. If things are wrong, then you need to drive it the right way. You need to research. You need to read, you know, and even if it's somebody else in your family, like a loved one, you should read. You shouldn't just sit there and be ignorant. I'm sorry, but you have to read about things, or if there's a symptom that is showing up that doesn't look right, read about it. If you're not sure, then of course drive it the right way and make sure you get what you need. I will see you on another video where I'm going to talk about how I felt in the motions of the diagnosis and what happened next. If you have read my blog on WordPress, you will see what happened next. Well, you will read what happened next and you will see some pictures and etc. But if you haven't read my WordPress, wait for me on the next video. Share this video with somebody. Don't forget to subscribe. Don't forget to follow me on Instagram and like this video, comment, ask me questions. If there's things that I have not spoken about in detail and you want to know, please comment below. If you need any advice or anything like that, DM me on my Instagram. I'm willing to respond to you. But anyway, I'll see you again on another video. Maybe Tokyo will be on set, maybe not, because it was hard work. But anyway, I'll see you soon.